Hello, my name is Corrie Hansen, and I'm here today to discuss Health Information Exchange. Health Information Exchange is a way to share patient health information amongst different healthcare providers throughout different healthcare systems. It was implemented to improve patient satisfaction and quality of care. Health Information Exchange helps add completeness to patient records. Additionally, Health Information Exchange helps combine patient data into one interface to allow for a simplified view and review of records. It has been shown to reduce the total cost of care by decreasing duplicate lab and imaging costs, providing better medication reconciliation, more complete health and immunization records, and decreasing hospital admissions. In addition to improving patient outcomes, the Health Information Exchange can also be used to improve population health through improved public health reporting and monitoring. The big push for Health Information Exchange started in 2009 with the passage of the Health Information Technology for Economic and Clinical Health Act, or HITECH Act. This act was implemented to promote the use of patient health information technology, promoting the use of electronic health records, or EHRs, to ultimately improve outcomes. The act originally provided incentive for meaningful electronic health record use. When HITECH was first initiated, only 15.6% of hospitals used EHRs. By 2014, 97% of hospitals had adopted an EHR. The HITECH Act also strengthened HIPAA and patient privacy laws, holding healthcare businesses and providers to the same data breach liability standards and strongly enforcing penalties for data breaches. Additionally, the HITECH Act provided a push for e-prescribing and electronic transmission of laboratory results. The need for Health Information Exchange was reinforced in 2016 with the 21st Century Cures Act. This act enforces penalties for actions that prevent or discourage access to electronic health data. The eHealth Exchange is a national health information network which allows providers to share information securely via the Internet. The eHealth Exchange provides a set of standards, policies, and procedures to allow for safe information exchange amongst healthcare providers. It is active in all 50 states. About 50% of U.S. hospitals, 26,000 medical groups, and 100 million patients participate in the National Health Exchange. Participation in National Exchange is voluntary and not mandated at the federal level. Different states have various laws about consent and participation in Health Information Exchange. The eHealth Exchange provides standardization and consistency amongst participating organizations through the Data Use and Reciprocal Support Agreement. This is a multi-party trust agreement for those health information exchanges who want to use data across states. Its purpose is to avoid multiple state-to-state contracts by standardizing requirements for all states participating in the eHealth Exchange. North Carolina is a participant in the eHealth Exchange, so we currently share information with Coastal Connect Health Information Exchange out of Wilmington, the East Tennessee Health Information Exchange, Georgia Health Information Network out of Georgia, and also another one in Georgia out of Augusta, Med Virginia out of Richmond, Virginia, the Health Information Exchange in South Carolina, and the U.S. Department of Veterans Affairs. The North Carolina Health Information Exchange is called NC Health Connects. It is a public entity, not private. This government agency is not concerned with profit, but rather improving access to health data for the state of North Carolina. Therefore, there is no charge to participate in NC Health Connects. In 2015, a law was passed which created the NC Health Information Exchange Authority to oversee the exchange of health information in North Carolina. NC Health Connects electronically connects systems and health information networks to allow providers to review health information from various sources. Any healthcare provider that uses state funding, including Medicaid and the state health plan, must eventually participate in the exchange. By June 2018, hospitals, physicians, physician assistants, and nurse practitioners should all have access to NC Health Connects if they provide Medicaid services and have an electronic health record. By 2009, all other Medicaid and state-funded services should have been connected via NC Health Connects. However, this was recently delayed until June 2020. By June 2020, all other Medicaid providers and managed care organizations must submit claims to the NC Health Exchange via NC Connects. Lastly, by June 2021, dentists, ambulatory surgical centers, psychiatrists, and the State Lab of Public Health, and pharmacies should all be connected. To be connected means clinical and demographic data is sent to the Health Information Exchange at least twice daily. Information can be sent via the electronic health record vendor or directly through the NC Connect Health Exchange. Electronic health records must be able to send HL7 messages in order to effectively participate in NC Health Connects. There are two types of participation agreements, submission only and full participation. With full participation, providers can not only upload data, but also access reports, clinical notifications, and public health data. Submission-only agreements, on the other hand, allow providers to be compliant with Health Information Exchange Acts by submitting data, but it does not allow for access and use of other data exchange information. Considering there is currently no cost to participating in NC Health Connects, I am not sure why healthcare organizations would not choose the full participation agreement. As of April 2019, 97 hospitals and 4,600 practices participate in NC Health Connects. As NC Health Connects evolves, more features are becoming available, including direct connection with the NC STOP Act Controlled Substances Reporting System and clinical event notifications through NC Notify. NC Notify lets providers know when a patient was seen outside of their healthcare system by providing diagnostic information, summaries, and plans of care. This helps allow providers decide if an urgent follow-up is needed. Providers must register for NC Notify notifications. Great advances are being made in Health Information Exchange. However, in order to reap all of the benefits of Health Information Exchange in North Carolina, healthcare providers need more information. For example, I asked my preceptor about her experience with NC Health Connects, and she had no idea what I was talking about. She does have Epic at her work site and uses Care Everywhere. Essentially, this is participation within the exchange. However, she was unfamiliar with the term NC Health Connect. Therefore, she did not know about NC Notify. Providers should be educated on how Health Information Exchange works within their institution. Mandatory education to allow for review of features and incorporation of outside records into daily workflow would be beneficial in advancing the purpose of Health Information Exchange in North Carolina. Secondly, to advance Health Information Exchange in North Carolina, efforts need to focus beyond data collection into data utilization. Organizations should collaborate on multi-facility quality improvement projects to tackle population health. As Health Information Exchange advances, IT teams should learn how to pull reports for a geographical area using multiple health practice records. For example, if a certain geographical area has a higher prevalence of tobacco smokers, data should be gathered, and healthcare providers and stakeholders in that community should collaborate and use data from the Health Information Exchange to create a large quality improvement project to reduce the prevalence of smoking in that area. There are many ways to use Health Information Exchange. This video provides just a brief summary. As future providers, it is our responsibility to stay up to date on health informatics and Health Information Exchange. Thank you and have a great day.